friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hello, people. What's up? I went to Atlanta this past weekend for a veterinary advisory board meeting and got to meet some people I've never met before, vet practice owners, had a great time. So I'm tired because I drove to Atlanta on Friday and I drove home Saturday, and I got home at 1 a.m. on Saturday night, but it took like 6 hours to get to Atlanta from Nashville, which normally it should take like 4 on Friday. So that was terrible. So it was a quick turnaround trip. So I'd be tired. I sort of have a hot take. I've actually talked about this before, but a few things lately have made me want to talk about it more, which is what I've said, that not all veterinary medicine is created equally, which is a little bit of a controversial thing to say. It can be, because I want to make sure I talk about this the right way. I probably will offend some people, but I think it's something we sort of dance around because we don't want to hurt people's feelings. But something that I see from my perspective as a veterinarian who posts on the internet and hears from the general public a lot about what they think about things that are being talked about in vet med, is that we want to protect our profession, right? And we don't want to talk bad about anyone in our profession. But when it comes to general veterinary practice and specialty veterinary practice as well, these are humans involved. And not all, especially in vet med, even compared to human med, not all people who are practicing medicine are doing that at the same caliber, I guess I should say. Meaning, not all GP veterinarians are keeping up with what current research says, or going to continuing education and learning what is changing and what are new or different or better ways to treat diseases. And that can trickle down into ways that patients are being treated. And what I see personally in at least general practice veterinary medicine are the consequences of that, which I think are bigger picture than maybe people even realize. One of them on the individual level with the patients is that, for me, I see a lot of patients for like a second opinion who've been seen by a veterinarian who maybe isn't doing those things and is practicing what we would call old school medicine. And they've been treated over and over again the same way for something, and maybe the root cause of the problem isn't being addressed. What I'm really thinking about when I say that is like allergies. So dogs with allergies or skin issues, I shouldn't say allergies, dogs with itching skin issues, and it's assumed that it's allergies. I see them treated by certain veterinarians sometimes just over and over again with antibiotics and steroids for short courses of time over and over again, or even other allergy management things, but they're just doing the same thing over and over again. And no one has discussed kind of big picture things with the owner, or no one has explained that we're giving steroids to treat the inflammation and we're giving antibiotics to treat the secondary infection. But both of those things are caused by an underlying problem. And in order to figure out what that is, we would need to do more things, whether that's more diagnostics or trying different therapies or referring you to a specialist like a dermatologist. And the frustrating thing, I think, is that veterinarians who then see those patients are caught in this tricky situation where, maybe that vet that's been seeing them, they really, really like, and they think it might be in the same practice. They think, oh, they're great, and I've been seeing them for 40 years, and so of course I'm doing what they say. And so we have to balance, hey, this is maybe not the best way to treat this. Also with, I wasn't the person seeing that dog 3 weeks ago, so I don't know what everything really looked like. So it's tricky, and it's a tricky thing to talk about. So my message to pet owners when I talk about this is just to remember that it's always okay to get a second opinion. And I say that with a grain of salt because Do I think you should just go seek a second opinion anytime you're not sure about something? No. But if you are seeing the same veterinarian, or this applies to human medicine over and over again for the same problem, and you feel like not really getting anywhere, it doesn't mean that that doctor is doing something wrong, but it also can mean that something isn't being done that could be, or we just need some fresh eyes, fresh thoughts on the situation. And then the other thing that I'm just going to be brave and say is that there are some veterinarians out there who are practicing really old school medicine, and it's not good. And steroids are not the answer for everything. And antibiotics are not the answer for everything. And wait and see is not the answer for a lot of things. And I see a lot of that secondhand, and it exists and it's real. And, a dental cleaning probably shouldn't cost $150. And if it does in a vet clinic, then in a lot of situations, that means that high quality care is not being performed or given. And that can mean your pet is being put at risk. So I don't say any of this to scare anyone or talk bad about anyone or call anyone out specifically. It's just really important to me to educate you all on these things, because I want to empower you to understand, okay, this is what I've learned about this. This is what a lot of veterinarians are doing, and my veterinarian is doing something completely different. It doesn't mean it's wrong. It just means it might be something to think about. So anyway, that is a lot of the reason why I do what I do here. And I really hope that I can help educate you all just about what these diseases and issues are, and not necessarily just how I treat them, but how the field consensus treats them, or says we should work them up, or says is the reason why they're happening. Okay, I hope that all makes sense. Okay, here's what we're going to talk about today. Moving along, we're going to talk about cats, which we've talked about this. We don't talk about cats enough, so I'm trying to do that more. I'm working on it. And so we're going to do a cat topic today, which is urinary problems in cats, specifically fluted and FIC. We're going to talk about what all those letters mean. So if you've never heard these terms, cats do weird things, right? We've established this. And so what I wanted to talk to you all about is kind of common urinary issues, especially because, sort of related to what I was just talking about for my hot take, is that a lot of cats with urinary problems can be managed in ways that are probably not what's best for them. So we're going to get into all of it. So specifically, we're going to talk about fluted and FIC. So fluted, FLUTD, is an acronym we use for feline lower urinary tract disease. Okay. And really, we've kind of changed these titles, but fluted is just a very generic term for a conglomeration of issues that cause urinary problems in cats. Okay. FIC, feline idiopathic cystitis, is a subcategory. So it's one of the possible causes of fluted lower urinary tract disease. FIC is the most common cause of fluted. For a while, we just sort of called FIC fluted, but now we've sort of made things more specific. So this is important. So a lot of cats have fluted. They have lower urinary tract disease. They have bladder and urethra problems. Most of those cats have those problems because they have feline idiopathic cystitis, which is FIC. So there are other causes of fluted. So urinary tract infections are a cause of fluted. Urinary stones, bladder stones are a cause of fluted. And bladder tumors, anatomical problems. There are a lot of other possible reasons for fluted. But like I said, FIC is the most common, and that's what we're going to really talk about today. So the veterinary field is learning more and more about FIC in cats, and a lot has been sort of developed and sort of hashed out more recently about FIC. We're learning more about it, how it works in cats. Like I've told you before, cats are weird. Cats do weird things. Cats and horses. I mean, they come from the same arm of something because they both do weird things and they sort of do things in a similarly weird way. But cats are weird, and we now are establishing this pathway between behavioral stress issues and bladder issues in cats, which is really fascinating and very, very interesting. And so we're going to talk about FIC. So what is FIC? Basically, it's inflammation of the bladder wall for no obvious apparent reason, but really it's probably because of stress, which we're going to talk about. That inflammation causes a host of problems. What it looks like to you, a cat owner, would be a range of urinary symptoms. Most commonly, we're going to see cats who are urinating out of the litter box. They're urinating frequently, small amounts. It can be painful for them to urinate. There can be blood in their urine, and they can have other issues. They cannot feel well. They cannot eat well because of all of this that's happening. A lot of times people that have FIC cats note that their cats are just like obsessed with being in the litter box. They're in there trying to pee a little bit at a time all the time, or they're peeing all over their house or in one place over and over again that's not the litter box. And that's what we hear when we talk to clients with cats that probably have FIC. Female and male cats can have FIC. Male cats are sort of the poster children for this issue. Some of that has to do with their anatomy. Their urethra is obviously a little bit different than females. It's a little bit more narrow. It actually turns a little bit. And the connection between stress and the brain and the bladder is interesting. So let's talk about it. So basically what happens when cats are stressed, which also, if you don't know, cats can be stressed for like so many reasons. You could, open the cereal box a different way one day and your cat is suddenly stressed out. You could call your spouse by a different name and your cat is stressed out. So cats are very, very sensitive. And when they get stressed, which can be for a lot of different reasons, stress activates the sympathetic nervous system, which is closely tied to the bladder wall. And so there's a pathway where inflammatory neurotransmitters are released and the bladder wall becomes inflamed. That pain, those pain signals are triggered because of that. That tells the brain something's going on. The brain responds with more sympathetic nervous system output, and then the inflammation continues. So it's a vicious cycle. This is the theory of the brain-bladder pathway connection. That is this basically neuroinflammatory loop that leads to the development and progression of FIC. And so why are some cats that way? I don't think that really has been fleshed out yet, but some cats have a heightened stress response, and these are the cats that probably have FIC. In male cats with FIC, this chronic recurrent inflammation can lead to the formation of plugs, little like deposits of material in their bladder that can become lodged in their urethra and cause an obstruction. That's a really dangerous problem that can be related to FIC. So we're going to talk about that more specifically in a couple minutes. So when we think about the bladder in cats, so the wall of the bladder, so the inside surface of the bladder where the urine is touching because it's inside the bladder, it has a thin barrier layer called the gag layer, and that is protective. It helps protect the tissue of the bladder wall from urine because urine, right, is a caustic, or it can be a caustic liquid. And in these FIC cats, the thought is that gag layer becomes thinner, and so that protective sort of layering on the inside of the bladder is not as effective. And so, like I said, urine is coming into contact with the nerve endings that should be protected in the bladder wall. Those nerves, because they're being irritated like that, they become hypersensitive. And so even normal urine in the bladder can be irritating and painful. All of this leads to increased urgency. It leads to urethral spasms. So that makes these cats feel like they need to pee. That's why they are going all the time. They can have increased frequency because this is inflammation, there are capillaries, blood vessels involved in the wall as well. And so they can have blood in their urine as well. Things that happen that I see happening when cats are having these symptoms in veterinary clinics that can be problematic is that veterinarians or just cat owners really want this to be a urinary tract infection. Like, oh, my cat's peeing everywhere, they're having trouble, whatever. And so, with or without bacteria being seen in the urine, some of these cats end up on antibiotics to try to treat a urinary tract infection. And the reality is that urinary tract infections in cats really just aren't very common, meaning bacterial infection in the bladder of a cat. It's not very common. And so if your cat is doing this over and over again and they get antibiotics and then it just comes back again, unless your vet has actually found bacteria in their urine on a urinalysis and or cultured their urine and grown bacteria, it's not an infection. They don't need antibiotics. And just giving those antibiotics can delay actually managing FIC appropriately. So this is a big issue with FIC, is that it's not an infection. It does not involve bacteria. It's inflammation, and treating with antibiotics is not going to fix it. Okay, so that's what FIC looks like. And like I said, it can be triggered by lots of types of stress, all kinds of stress. Anything that stresses a cat out. You moved, you had a visitor, you got a new puppy, you moved the furniture, all the other things I said. Anything out of the ordinary can trigger cat stress and can lead to this. So the way we diagnose FIC is basically a diagnosis of exclusion on a urinalysis. So if we get a urine sample, we look at it, we often are going to see inflammatory cells. So white blood cells, often red blood cells, but we're not going to see bacteria. If your vet is working your cat up for this, they're probably going to try to rule out other things like, so an infection, they're going to rule out bladder stones. They may want to take an x-ray, ultrasound the bladder, make sure they don't see anything that looks like stones. And then basically we say we can't find any other reason this cat fits the mold for FIC. The symptoms look like it. Everything else looks like it. We don't see anything else, obviously. So basically, those are FIC cats because they're not anything else, and it fits the clinical picture. So when we see cats who have FIC and they have an acute flare of FIC, every vet's going to do this a little bit differently. Pain control is one thing. This is uncomfortable. These cats are uncomfortable. So things like buprenorphine, gabapentin, other pain medications can be used because this condition can cause spasms in the urethra. A lot of veterinarians are going to prescribe antispasmodic medications. One that's very commonly used is called prazosin. I just want to fill you in. There's a little bit of veterinary field drama about prazosin, and that's because a study came out that basically indicated that cats who got prazosin that were blocked, so most of the time about male cats, if they were blocked, they had an obstruction in their urinary tract, they got prazosin, they were more likely to get blocked again. So that study is a little bit problematic for a lot of different reasons, and veterinarians take it different ways. And so some veterinarians are avoiding prazosin. I personally am not one of them. I think that study is flawed in a lot of ways, and I think cats that need prazosin in the first place are going to reblock sometimes anyway, but that's neither here nor there. If we think cats are dehydrated, we're probably going to give them fluids. We definitely will give them fluids if we think they're dehydrated, depending on how dehydrated we think they are. Sub-Q fluids, IV fluids, both can be used. And sometimes we'll give them short-term anti-anxiety medications. Or long-term. Another medication that I personally like to use is meropitant, which is, you may know it as Cerenia. It's an anti-vomiting, it's an antiemetic drug, but it has been shown to help with inflammation in the bladder wall. So I do use Cerenia for these cats, and I know a lot of my colleagues do as well. There's not a lot of research evidence that we need to be using it, but anecdotally in practice, I find that it helps. So I use it. So when we see a cat in an acute flare-up of FIC, they're uncomfortable, they're having these symptoms, we've ruled out an infection, we've ruled out stones, that's how I'm going to treat it. That's how a lot of my colleagues are going to treat it. We're going to try to find the source of the stress at home, try to help with that. And in male cats, we get really anxious about them getting obstructed. So urinary obstruction in cats is a really dangerous situation if you didn't know this. Male cats, like I said, because of their anatomy, are the kind of cats who are more likely to get obstructed. If you have a male cat who has any history of symptoms that are anything like this that I'm talking about, FIC, they are at risk of being blocked. And so if you have a male cat or any cat and you feel like it's been a long time since they've been able to go to the bathroom, they're posturing to urinate and nothing is coming out. If they're like dripping bloody pee, they may be becoming obstructed. But obstructed cats, they have a piece of material or pieces of material. It's often this like concretion of white blood cells and particles that have been floating around their bladder. They come together, they cause an obstruction. They cannot pee. There is basically a rock lodged in their urethra. And so all that urine can't pass. They feel like they need to pee. Their bladder is stretching. It's getting overly full. They're posturing to pee and they can't do it. Eventually what happens is they get very, very sick. They're painful. They can go into kidney failure because of all the urine that's getting backed up all the way up to their kidneys. Their kidneys can't flush out and their abdomen is uncomfortable and they get really sick. They're in kidney failure. And eventually their potassium levels can get so high that they will pass away, sometimes from heart issues because of those levels and just the acute renal failure. So obstructed urinary cats is always an emergency. If you ever think that maybe your cat can't go to the bathroom, especially if they have this history, you need to call your vet. If your vet's not open, you need to call an emergency vet and see if they agree and that you need to come in. If we see obstructed cats, what we're going to do in veterinary practice is one, we want to confirm they're obstructed. We want to make sure that cat is stable. So we're going to run blood work. Are they in kidney failure? What are their potassium levels? What's everything look like? What does their heart sound like? Maybe run an EKG. What's their heart rhythm look like? And then as long as whether they're stable or not, but once we've started to stabilize them, if they need that, then we're going to do everything we can to unobstruct them. And so we can pass a urinary catheter. We can do different things to push that concretion that's obstructing them back up into the bladder so that then urine can escape the bladder. Sometimes we'll manually reduce the bladder. It can rupture. The bladder can rupture. And when these cats go into kidney failure, obviously they need treatment for that. And so this is very, very serious. Cats die from urinary obstruction all the time. Cats get hospitalized in ERs with huge bills all the time because of obstruction. So it's always urgent. It's usually an emergency, and it can be a really big deal to fix it. They often have to be hospitalized for a couple of days. They have urinary catheters that are sewn into them for that time frame. And some of these cats, they reblock over time. They can do this multiple times. And eventually, something that can happen to help prevent this is a surgery called a PU, a perineal urethrostomy, where we reroute their urethra and their urine into a bigger opening so that they stop getting obstructed. Obviously, that's involved and not cheap. And so those are some of the complications that happen in a specifically male cats that have FIC. Okay, so back to FIC. Besides the acute treatment of a cat that's got it and is all, irritated, things we do for long-term management are equally as important. Okay, so at home, we want to give these cats all the reason to use litter box that they like. So sometimes stress in cats is because they don't like their new litter box or their new litter. So we want cats to have quiet places to have their litter box. We want to find the type of litter that they like. We want to find the type of box that they like. We want to increase their hydration. The reason hydration is so important in cats that get FIC is because the more concentrated their urine is, the more caustic it is. We know that layer that protects the bladder is already thin. And so the more irritating it's going to be to the bladder wall. So if we can dilute out their urine because they're drinking lots of water, that can make their actual urine less caustic and less irritating to their bladder wall. And then obviously we want to reduce their stress. So we try to figure out what are the triggers, how do we reduce them, how do we keep this cat less stressed. Sometimes that does involve anti-anxiety medications long term. Definitely have FIC cats that are on medications to keep them in a more zen state long term. When we talk about like environmental enrichment, environmental improvement, low stress environments for cats, cats are creatures of habit. They want things to stay the same. So most cats do crave predictable routines. It's great for cats to have enrichment in their home. So vertical spaces, so cat trees, wall platforms, ramps, things for them to do within the house. Cats like also places to go hide and have time to themselves and not have to see you. So hiding spots are good. Actually playing with them, interactive play that mimics predation can really help cats. So they feel like they're hunting something and get toys where they have to chase something or find something. It can be really great for cats to have multiple ways to eat, multiple ways to drink, multiple ways to go to the bathroom. Cats like options, right? Cats are divas. They want their routine. They want things their way. They want you to interact with them, but they want you to give them space, and they want options when it comes to eating, drinking, and going to the bathroom. If you have a multi-cat household, if there's conflict going on between your cats, that's obviously also possibly a source of stress for them. There are a lot of things you can add in your home to reduce stress. So there are pheromone products, pheromone diffusers, different things like that, collars, sprays that can help reduce stress in cats. Pheromones are a very cool thing. And then, like I said, hydration. Hydration is really important. So how can you do that? So encouraging cats to drink, which I know sounds a little ridiculous, but some cats really like moving water. And so there's great fountains you can get. Pet Libro's a brand I really like, but water fountains for cats, multiple options, like I said, canned food, wet food can be very helpful for this. Obviously, if your cat likes canned food, you should never not feed canned food. Sometimes I see veterinarians, particularly vets and vet techs who work in like the nutrition space, they want to argue with people online about how it's okay for cats to eat dry food. Well, yeah, of course it's okay for cats to eat dry food, but it's also really good for cats to eat canned food. This is one thing about VetNet online that really annoys me. Like, there's nothing wrong with cats eating canned food. It's actually very good for cats to eat canned food and take in more moisture. No cat is going to harm themselves by ingesting too much water in their food. And so canned food is a good thing. I encourage all of my cat clients to at least feed some canned or wet food. And that obviously increases the amount of moisture they intake during the day. You can use broth and water as like a topper for dry foods as well to moisten them. And again, multiple water stations can be a great idea. So, medication we don't have a way that we know of yet to completely like prevent FIC with medication. I would say FIC is one of these diseases where management, nutrition, management, enrichment can be just as effective, if not more effective than any kind of medication. So we use medications to treat the acute flare-ups. We definitely use medication in some cases to decrease stress. So anti-anxiety meds definitely have a great place in these cats. And we sometimes use chronic medications for pain. Amitriptyline is a medication that we use sometimes that can kind of address the pain and stress component. Gabapentin is one that's often used long-term for pain. And it's really a multimodal approach. It's complicated. I always tell people with cats that I see for the first time having symptoms of FIC, like, hey, this can be a long road. It can be frustrating. It's never perfect. We're never going to just fix it forever. There's always going to be flare-ups in most cases. But I think the most important thing is that we recognize what it is. We recognize it's not infection. We don't need to just give your cat antibiotics. And there's a reason we want to run a urinalysis to make sure there isn't bacteria and then move on from that. Stress is the problem. And so reducing that is probably the most important thing that we do. There's research going into this. Veterinary scientists are trying to figure out, what helps, what are some of the triggers. There's some thought that the microbiome has a lot to do with this. I always think that that's a great thought. And, I think probiotics for everybody. And again, they certainly don't hurt anything. So there's never anything wrong with trying something like a probiotic as long as it's safe for your pet to take. Other things that people use to try to help, there are supplements that can help with that gag layer, or the protective layer, glycosaminoglycogens, I've said. Anyway, I like to put these cats on a glucosamine supplement for cats. So Cosequin for cats is one I like a lot. That's easy to get. Pentosan is another PS gag that helps with that layer, or it's supposed to. There are hyaluronic acid products. So a lot of different things that are thought to help with that gag layer. None of it is fully supported by research, but as long as these products are safe for your vet to try, I think they can help with the protective coating of the bladder and hopefully reduce incidences of these flare-ups. There's also growing evidence for different anti-anxiety medications or treatments, nutraceuticals that can help with this. You'll find different ingredients like, what's it called? Alpha casozepine, which is what's in Zilkine, L-theanine, tryptophan, and then the pheromones, like I talked about, these kind of nutraceutical products that we think help with that stress, pain, bladder pathway. Again, not a ton of research into these things. I think that that's growing, but they're definitely things to think about, ask your vet about, and maybe try. And then, like I said, there are some medications that, like prazosin, to help with the urethral spasms. But again, we're using that usually just when we're having a flare-up. And then I would be remiss to not mention that there are integrative therapies, alternative therapies like acupuncture and chiropractic treatments performed by licensed veterinarians that can help with these issues. And I think there's a place for all of that. And I think integrating that with Western medicine to manage these flare-ups is a really, really great idea. I have a lot of clients that have utilized acupuncture for cats with FIC, and we definitely see that seem to help. So, yeah, that's a lot of information about cats and their bladders, but it's important. Hopefully, if you have a cat that's been dealing with these issues, if it hasn't been called FIC or fluted, then that might be what it is. You might want to chat with your vet about it. So I hope this is helpful. Send me questions if you have them. You can send them directly to me at Dr. Molly Says or the podcast page, Dr. Molly Says Pod. You can also email us, drmollysayspod@gmail.com. Make sure you're following us. Make sure you're subscribing. If you're listening, you can watch this on YouTube and vice versa. And I will see you next week on the next episode of the Dr. Molly Says podcast.